Good day. My name is Raquel, Hatulan, a first-year student nurse at Davao Doctors College. I am from Section 11C and my RLE group is Group 11. In this video, I will show you the assessment of cranial nerves. The assessment of cranial nerves is done to provide an insightful information about a patient's nervous system. Now we are at the pre-introductory phase. The first thing that I would do is review the client's medical record and also the doctor's order. This is done to verify the order. The scope of my assessment is the cranial nerves. In line with this, I have to prepare my equipment to save time and energy and to ensure organization. So, the equipment that I would need during the assessment are: first is the Q-tips or the cotton buds. Second are my cotton balls. Tongue depressor, so it's still inside the box. Pen light, newsprint, the bar of soap, and also a tuning fork. So assuming that this is a tuning fork, since we don't really have tuning fork at home. So before meeting the patient and proceed to the assessment, I have to perform hand washing first to deter the spread of microorganisms. Good morning, ma'am. My name is Raquel Hatulan, a first-year student nurse at Davao Doctors College. I will be your student nurse for today. Before we proceed to anything else, I would just like to confirm your identity to be sure that I have the right patient for today. Can you please tell me your name, your age, and your birthday?
Rachel Bungkayaw, December 13, 1971, 49 years.
Okay, so during the assessment, how would you like me to call you or address you?
You just call me Rachel.
Okay, Rachel. So the scope of my assessment is the cranial nerves. In the human body, we have 12 cranial nerves. In line with this, I am going to test or perform several procedures that will test your cranial nerves. Along with this, I am going to use several equipment that will help me. It is very important that you cooperate so that our assessment for today will be successful. Do you have clarifications or questions?
No.
Okay. So we provide information to our clients because it fosters cooperation. Okay, Rachel, I want you to know that our medical procedure here will remain confidential to protect your privacy. Also, our assessment area is secured, safe, and is free from distractions. So we assure you this so that our assessment will be free from distractions. Also, here is your patient's gown. This is what you're going to use during the assessment. Okay, please sit here. So during the assessment, you will be in a sitting position. Now we are at the working phase. The first thing that I would do is assess the CN1 or the olfactory. So, by the use of the Q-tip, I will let my patient clean her nose. Okay, Rachel, please clean both sides of your nose. So we do this to remove the mucus. So now, please close your eyes. I'm going to let the client describe what she's going to smell. So, we're going to occlude one nostril. Okay. Can you smell it?
Yes.
Okay, so the other nose can smell it.
Yes.
Can you please describe the smell?
It's a bar soap.
Okay. So the odor of the bar soap helps to stimulate the olfactory receptors. Now we are going to assess the CM2, which is the optic. So I'm going to test for for the visual acuity of the patient first by the help of the newsprint. This will help to test the patient's near vision. So I am going to stand about 14 inches from her and let her read the newsprint of this part. Okay? So, can you read this one?
Dr. Ray T. Albano, the ever-dynamic president of Holy Trinity College of General Santos City.
Okay. So, the patient was able to read this part. We're still assessing the optic nerve, but now we're going to test for the visual fields using my fingers. Okay, so Rachel, I'm going to move my fingers on your side. As I move it, tell me once you identify my moving fingers, okay? So, 1, 2, 3, go.
It's moving.
Okay.
It's moving.
Okay.
It's moving.
Okay. Now we move on to the assessment of CN3, 4, and 6. These are the oculomotor, trochlear, and the abducens. Okay, so now please look directly at me as I observe your pupils and eyelids. Okay, so I am going to shine a light to observe your pupillary reactions, the consensual and also the direct light reaction. Okay, so I'm going to start on your left eye. Okay, the left eye. Okay. So now I want you to focus on my finger, and while focusing on my finger, I'm going to ask you to look from afar. I'm still going to observe your eyes. Okay, so look at my finger. Look from afar. Look at my finger. Look from afar.
Okay.
Okay, so now we're going to check your extraocular movement. So, just follow what my finger draws in the air. Okay? Okay, so now we move on to CN5, which is the trigeminal. First, we are going to test for the pain. What I'm going to use here is the dull and the sharp area of the Q-tips. So we do this to compare the symmetrical areas of both sides of the face. Okay, so I am going to touch your cheeks, your chin, and also your forehead. Okay, so tell me if you recognize something dull or sharp. Okay.
Sharp. 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 Sharp.
Okay. So I'm gonna repeat it.
It's a dull. 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 Dull.
Okay. So now we are going to test for the light touch. What we're going to use here is the wisp of cotton. So Rachel, tell me if you feel it once again. Okay? Tell me if you feel something light.
It's a light. 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 Light.
So the next one is to check for the corneal reflex. I am going to use a wisp of cotton to lightly touch the cornea. So we do this to check if the eyes blink bilaterally. Okay, Rachel, so look on the side, look up, look on the side. Okay. Okay. So we're going to proceed to the other side. Okay, look up. Look on that side. We're looking up. Again, please. Look up properly and look on that side. Okay. Now we proceed to the assessment of CN7, which is the facial nerve. Okay, Rachel, please do what I'm going to ask you to do. Please smile Okay. Frown. Okay. Show me your teeth. Okay. Purse lips. Raise your eyebrows. Close your eyes tightly. Okay. Very good. So we do this to see if the client can easily and normally do these maneuvers. Okay, so now we move on to CNA, which is the acoustic or the vestibulocochlear nerve. Okay, so I'm going to whisper something and cover my mouth so that you can read my my lips, and then you're going to repeat what I say, but say it normally. Okay, so but before that, please cover your right ear. Yes, do it like this so that, okay. Because I'm going to test your ear, one ear at a time. Okay, so repeat what I'm going to say.
Mama.
Okay. Cover your other ear next. Okay.
Mama.
Okay, very good. The next thing that we're going to do is assess for lateralization. So we are going to perform the Weber's test. What we're going to use here is a tuning fork. So since we don't have a tuning fork at home, we are going to use this as an alternative instead. So assuming that this is a tuning fork. So I'm going to place it, assuming that this is a vibrating tuning fork, I'm going to place it on the patient's head. And then as it vibrates, I'm going to ask the client if she can hear it equally or whether she can hear it more loudly on the right side of her ear or on her left side of the ear. Okay? So Rachel, is it louder on your right ear or on your left ear, or is it normal?
Normal.
Okay. So the client said that she can hear it normally on both sides of her ear. Next, we are going to perform the ring test to compare air and bone conduction. So we are still going to use our tuning fork. Okay, so now I'm going to place the tuning fork on the mastoid process. So tell me if once you don't hear the vibration anymore.
I can hear it.
Okay. Tell me once you hear it.
I hear the sound.
Okay, now we're going to move to the other side and to do the same thing. Okay, so I'm going to test on your mastoid process first. Tell me once you cannot hear it anymore.
Cannot hear anything.
Okay. So I'm going to transfer to your ear canal now.
Hear the sound.
Okay. Now we proceed to CN9 and then the glossopharyngeal and vagus cranial nerves. We do this to test the motor function. Okay, so I'm gonna have you open your mouth. Okay, so I'm gonna ask you to say ah as I put the tongue depressor because I'm going to assess your voice and also to observe your uvula and your palate. Okay? Okay, open your mouth. Okay, say wider please. Okay. Say ah.
Ah.
Again please.
Ah.
Okay, so the next that we're going to test is the gag reflex. We do this to see if the throat has a response to contract. So we're going to do this one side at a time and I'm going to insert a tongue depressor once again. Okay, so it's very important that we are going to warn our patient once we insert the tongue depressor. Okay, so Rachel, open your mouth. This will be a little bit uncomfortable. Okay, so if there is a gag reflex, just swallow, okay? Okay? There. No, don't say anything, just so that I can see. I'm going to do it on your right side first. So, we are done with the left side and now we're going to do the same thing on the right side. Okay, please open your mouth. Hmm? Okay. Now we move on to CM11, which is the spinal accessory. We do this to see the strength of some muscles on this area. So first, we are going to evaluate the trapezius muscle. Okay, Rachel, so you're gonna shrug your shoulders in order for you to reach my hand. 1, 2, 3, go. Okay, go. Okay, go. Okay. Very good. The next thing that we're going to evaluate is the sternocleidomastoid muscle. Okay, so I'm going to place my hand here, and then you're going to turn your head against my hand, like this. Okay, go. Okay, so you're gonna, okay, do it properly. Okay, so we're gonna proceed to the right side first, and then I'm going to observe your sternocleidomastoid muscle on this area. Okay, do it properly. Stand, stand. Okay. So we're both observing your sternocleidomastoid here. Okay, good. Okay, so we're going to switch to the other side. That's enough. So, okay, turn your head on the right side. And do it now properly. Like, let it this way. Okay. Okay, so we're observing the sternocleidomastoid muscle on this side. Okay. Okay, the last one is the CF12, which is the hypoglossal. We are going to assess for the tongue atrophy and its fasciculations. Okay, so Rachel, what I want you to do here is stick your tongue out like this. Okay, so I'm going to observe your tongue. So I'm just going to note for asymmetry and deviations from the midline if there is any. Please take it properly. Okay, very good. You can close your mouth now. Okay, Rachel, so our assessment ends there. So now you can go back to your normal clothing. Okay, Rachel, thank you so much. So for our findings today, we didn't find any abnormalities. Everything was normal. So thank you so much for being so cooperative today.
You're welcome.
Now I am just going to document the findings. I can use the electronic forms or the checklist supplemented by narrative notes.